Indeed, we must avoid lockdown. This is a very, very disturbing fact that actually we're talking about it again. Lockdown has a very deep impact on public health, on mental health, on social aspects, and we have all the tools to escape it. Unfortunately, many of the suggestions that we had through the expert committee took lots of time to employ. I'm talking about the Green Pass, also about having a much more sense of urgency regarding vaccinations. We probably were too early to celebrate, of course, like the end of COVID. There won't be end of COVID. This doesn't mean that we need to be in alarm. It means that we need a sense of urgency to vaccinate, especially the first and second dose for the elderly. We're talking about 200,000 people. There are some good signs now that there's more collaboration with the local authorities, also to see how to prepare for the school year, both with vaccination, serological testing. And I'm happy to say that finally there is an agreement between the Ministry of Health and Ministry of Education. This is a very good sign because, the worst is to wait up until the last moment like we had so many times in the past. So we need to have a multi-layer system. Vaccination, of course, is number one, but this is not enough. We need to have all other aspects as well, including enforcement.
Yeah, we've certainly seen the top-down attention on the vaccine program here, but looking at the school year, you mentioned the rapid testing regime that's now been approved to come into effect here, to avoid locking down classrooms here. Kids will be tested. If there's an outbreak in their class, every day that classroom will have to test. They'll have to test to start the year. Does that seem like a reasonable way to commence the school year? But on top of that, are you concerned by the fact that the ultra-Orthodox sector, their school year is beginning today with none of these issues in place?
In terms of the school year, it's composed of several, there are several components. We need to do pooling with PCR tests. This will be once a week like we had previously, unfortunately, in a few schools, including a school of my youngest son. This is, in fact, taking place when you have the consent of more than 80% of parents. Then if there is a child that is positive, you can have, instead of a quarantine, you can have rapid tests, but this is when there is exposure. Otherwise, protective education, Magen Chinuch, as it's called in Hebrew, is about pooling every week. And of course, on top of that, increasing vaccination rates. Every community need to prepare already now, working together, parents, teachers, to see the specific context. Every place it's a bit different. If you can reduce the number of children, that's also a good option. As for the ultra-Orthodox, you're absolutely right. We entered, but I know that also there are lots of efforts now to do the serological testing and to start doing the rapid test. So this can be serving as a pilot that can teach us for all parts of the rest of the school system.